She's in a feeling up high, down low. We go from the floor to the ceiling. We fly, we fall, we get back up and try again. Some do, some don't, some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more. Big heart, big plans, big dreams, and we ain't even sleeping. Who can? We can. We dive right into the deep end. You win, you lose, you get back up and try again. Some do, some don't, some will, some won't. I wanna feel just a little, just a little, just a little. Put my heart in the middle, in the middle, in the middle. Wanna live just a little, just a little, just a little. Wanna feel just a little, just a little, little bit more, little bit more.
Good afternoon, everyone. Thank you for joining us today. I am Tanisha Murphy, your moderator. I am a former co-host of Bridge Street on News Channel 9 and the current co-host of TK99's Gomez and Company. I also work as the Research and Communications Officer in the Onondaga County Executive's Office. This month, the American Heart Association kicked off the Check It Challenge as a way to address high blood pressure in our region. The 4-month-long program empowers individuals to self-monitor their blood pressure and encourages healthy lifestyle choices. And I just want to say, this time last year, I was the Check It Challenge champion for News Channel 9, and I embraced the role. I went around and I made sure that all of my colleagues were checking their blood pressure, and I got to just about everybody in the station. And I'm happy to say that one of my colleagues since then, it's been a whole year, has lost 120 pounds, actually over 120 pounds. So if you can imagine what that has done to his blood pressure and a lot of other, ailments that he had at the time. So this challenge is near and dear to my heart, and I am so thrilled to be a part of it today. And if you aren't taking the challenge yet, you can still join at heart.org/checkitchallenge. We are thrilled that you have joined us for the first in our series of monthly Check It community conversations on matters related to blood pressure. A big thank you to our generous sponsors of the Check It Challenge that you can see on your screen, and especially Hillrom for supporting our February content, including this session. Today, we are joined by 4 local experts: cardiologist Dr. John Bisignano from the University of Rochester Medical Center, David Quinn and Susan Mangiacaro from Hillrom, and Dr. Shannon Miller from Kinney Drugs. They will begin our conversation, but we want this to be a dialogue, so we are looking forward to hearing from you as well. To start, we'd love for you to introduce yourself in the chat box. Please add your name or company and where you are joining us from. And while you're doing that, we are going to hear from someone who knows firsthand why the Check It Challenge is so important. Tanya Eunice, you can share why you #CheckIt.
Hello, everybody. I think that just knowing your numbers is so important. And personally, I had an experience with it. Probably about in 2019, I had been working with a program called Loving Myself, Loving My Sister. And as part of that program, they ask you to check your numbers. So at the end of the program, they would check your blood pressure. And my good friend, Tremita Carter, and also Franklin Fry, who also worked with me in this on this project, they would check it and my numbers kept running high. So it was about like 165 over 100 or 155 over 106 for examples. So after about 3 times of this, Franklin said to me, Tanya, you should probably, go see your doctor because it's just been consistently high. I had no symptoms. I felt perfectly fine. I'm normally just high spirited anyways, or a spaz. I like to call myself affectionately. But as it turned out, I did end up going to see my doctor and I was diagnosed with having high blood pressure and was then placed on medication after a little bit of monitoring. So, but for the Loving Myself, Loving My Sister program, because I didn't have any symptoms, I do believe that, I don't know, it could have turned out really badly for me. So now I am on medication. My blood pressure is normalized. I go and see my doctor and have it checked, once a year. And so I don't know. I just want to encourage people. It's just really important. I mean, you could have a stroke, you could have a heart attack and not have symptoms. So I guess that's what I really want to drive home. So that's it. That's my story. And I just wanted to share it with you all. And thank you for listening.
No, thank you, Tanya, for sharing your story. I mean, we are so glad that you are working to keep your blood pressure under control. And it's those personal stories that people need to hear, so that they can manage their own lifestyles and make changes. So thank you for sharing that. Throughout the presentation, please place your questions and comments in the Q&A box. We will ask your questions during a Q&A with our speakers after they have all shared. We are recording the session today and it will be available on the Check It Challenge Facebook event page and our YouTube channel. If you are using social media throughout this conversation, please use the handles you see on the screen at AHA New York and #CheckIt. Now, to get us started today, I'd like to introduce Dr. John Bisignano, who is a professor of medicine and director of the Comprehensive Hypertension Center in the Division of Cardiology at the University of Rochester Medical Center. He's the past president of the American Society of Hypertension and vice chair of the American Heart Association's High Blood Pressure Council. Dr. Bisignano, thank you for joining us today. Can you share? Hi.
Hi.
Can you share with us some of the basics of blood pressure and your perspectives as a cardiologist?
Sure. I think one of the most important things to realize is that elevations in blood pressure can really cause stroke, heart attack, heart failure, and kidney disease. So even small elevations in blood pressure over the target, which I'll get to in a moment, can make all these things worse. And I think as far as preventing stroke, heart attack, kidney disease, and heart failure is something that is very prevalent in our community. As many as 45 to 50% of people have a high blood pressure. And we know that treating high blood pressure, not necessarily with medications, can decrease these 4 important things. So what's a normal blood pressure? A normal blood pressure is 120 over 80. So at some point, if you have the genetic predisposition to hypertension, or if you happen to eat a lot of salt, be heavy, not exercise a lot on a regular basis, blood pressure can start drifting up. Now, this is something that tends to sneak up on people. And I remember this myself. You go to the doctor for the first time and they look at you and say, 135, is it usually that high? And you say, gee, I've never seen a 135 before. And that's really the first hint that you're no longer under 120 and that blood pressure is something you need to focus on. And if you wanted to guess whether you might have trouble with high blood pressure in the future or not, the thing to do is look around your Thanksgiving table. If the people around you, your parents, your brothers and sisters, grandparents have high blood pressure, there's a pretty good chance that you have the genes or the predilection to develop high blood pressure in the future. And you may be somebody who has to be particularly watchful of the blood pressure numbers. And when they start inching up over 120, realize that that's no longer normal. And when it's no longer normal, you're at a higher risk of heart attack, stroke, or kidney disease. So we don't really start treating blood pressure with medications until they're consistently over 130, or certainly if they're over 140. But I think the first step is to realize when the numbers just start nudging up, that's really a call to action to watch your lifestyle, to ask if you've gained 10 or 15 pounds, to ask if you're really doing the same amount of physical activity that you were doing a year or two before, and to look at your diet and see if you've gotten to a habit of putting salt on everything or eating a lot of canned or processed foods.
Dr. B, can you talk a little bit about back in 2017, some of the guidelines changed. And so can you talk about what the new normal is now? I know some people had that question.
Yeah, the guidelines changed in actually a very minor way in 2017. There were some changes, but the normal blood pressure, they reinforced, and this came from the American Heart Association, a normal blood pressure is 120/80. And the reason that we call that a normal blood pressure is it's the level of blood pressure in which there's the lowest amount of heart attack, stroke, and kidney disease. For every 20 points the blood pressure goes up, it doubles the risk of heart attack, stroke, and kidney disease. So even a blood pressure of 140 is a significant increase. And what they recommended in the 2017 guideline that you mentioned was that for people who have a history of kidney disease, a history of diabetes, or a history of any kind of cardiovascular disease, heart attack, stroke, any narrowing in any arteries, a blood pressure goal of 130/80 is probably advisable. If you don't have any of those three things, kidney disease, diabetes, or cardiovascular disease, 140 might be good enough, but you still might want to have it closer to 130/80. So if there's a take-home point I'd like most people to have here is that it's that 120 is normal. And if you're over 130, you're really at higher risk for heart attack, stroke, and kidney disease. And something probably needs to be done about that. First with lifestyle modification, but then, all the medications that we have for treating blood pressure now really have a low risk of side effects, and they're all generic. So pretty much they're all generic. We don't have to use expensive medications to treat blood pressure. And almost everybody in certain healthcare systems like the Kaiser system in California and clinical trials that we do, about 80% of people who have high blood pressure could have it under control using medications and lifestyle changes.
Okay, let's talk a little sports analogy here. Let's talk, white coat versus mass hypertension. Okay, who's winning that battle there? What do those terms mean?
Okay, so this is really important because the first time that someone goes to the doctor and their blood pressure is high, the first thing they say is, I'm nervous. It must be white coat hypertension. So I'm not usually this high. And they may be right. You have to ask the question, like, why is it happening now? And it's never happened for the previous 10 years. But they may be right that there's people who really do have sort of percolations in their blood pressure from time to time. Under certain amounts of the right kind of stress, their blood pressure will go up. And this really reinforces the importance of taking blood pressures at home, where you are 99.9% of the time. And in order to take a proper blood pressure, we do it wrong sometimes in the office because we sort of bring you in from the parking lot. We tell you you're late. We tell you something you don't want to hear, like, your insurance card is expired or something. There's something annoying that we often do in doctors' offices that drives up blood pressure. And as we put you on the scale and are talking to you, often take the blood pressure, which is all wrong. In order to take a good blood pressure, and a blood pressure measurement is a medical test. I view it the same as an X-ray or a CAT scan or an EKG. It has to be done right, because if you don't do it right, you're making a decision or a recommendation that you're going to stick with for 5 or 10 years and commit someone to medications and the label of being hypertensive. So it has to be done right. After 3 to 5 minutes of quiet rest, both feet on the ground, arms supported on the table, and nobody talking to you for 3 or 4 minutes. And that is the right way to take blood pressure, and those are the numbers that matter. So white coat hypertension, some people truly have it, but more commonly, it's an indicator the blood pressure is really high and can spike in the office. The other thing that you mentioned, called masked hypertension, and it has nothing to do with masks that we now wear all the time, about 15 to 20% of people have masked hypertension. And people with masked hypertension actually have better blood pressures in the office than they have at home. Now, many people on the call here may have masked hypertension. People who work every day, who may have stressful situations at home, may have stress somewhere else. It may be that going to a doctor's office visit for a measurement of your blood pressure and some other little thing is really not a bad day. But the problem with masked hypertension is that comes with a high cardiovascular risk of heart attack, stroke, and kidney disease. Whereas white coat hypertension, it's important to know it's there because you're going to know that your blood pressure is high every time you have something done. You go to the dentist, when you have go to the dermatologist. But masked hypertension requires treatment. And the only way to determine someone's right blood pressure is taking the blood pressures at home, using usually an ambulatory cuff, the kind that you could buy at any of our drugstores for $30 to $35. The electronics in these devices are great. They measure blood pressure very well, and they're considered the gold standard for many people. They really work. And when you go to an office and present a list of home blood pressures, that's something that your healthcare provider can really hang their hat on.
And you talked about taking your own blood pressure at home. At what point do you need to be concerned when you're taking your own blood pressure?
Well, the first point is if you're ever having symptoms that can be attributable to your blood pressure, headache, dizziness, chest pain, something like that, that's a reason for immediate concern, and you should seek medical attention for that. Generally speaking, high blood pressures, even 160, 170, sometimes even as high as 180, as long as you're feeling okay, nothing has to be done right away. But that would be a reason to call your doctor's office and say, I've been getting readings of 160, and if 120 is normal, that means I'm at 4 times the risk of heart attack and stroke. And that may be the time that your doctor may want to initiate a medication in addition to recommending lifestyle changes. Now, again, we want everyone to do the best as far as modifying their lifestyle. But I don't want people to think that taking a medication is a failure, because for most people, lifestyle modifications will improve their blood pressure by 10 or 20 points. But if somebody has a blood pressure of 160, 170, or 180, you're not going to bring it down to 130 just by avoiding a little bit of salt and exercising more for most people. So being on a blood pressure medication is not really an indication of a failure. It's an indication that your genetics are such that despite your best effort at lifestyle modification, and for some people, their best effort may be they can't do much right now, but fortunately we have these medications that can decrease the risk that you're under if your blood pressure is high.
Okay, here's my question to you. So if you're on the medication, and do you have to take it forever? If you've done your best efforts and you've changed your lifestyle as much as you can, do you have to continue to take the medication forever? So many people just don't want to be on medicine that they have to take for the rest of their life.
Yeah, and unfortunately, hypertension or high blood pressure is a chronic disease. It's like diabetes, it's like arthritis. It's not something that, like with an antibiotic, you take something for 2 or 3 weeks and hopefully things get better. Most people, if they need to be placed on a blood pressure medication, are on it pretty much permanently. Now, on the other hand, once in a while, I see people who are unable to do much from a lifestyle modification standpoint, but something changes in their life that all of a sudden they can exercise, they can lose weight, they can maintain more of a plant-based diet, do some major intervention. And for those people, if the blood pressure starts running consistently under 130, they can have some of their blood pressure medications decreased. So, unfortunately, like with many chronic diseases, someone who started on a medication is often on it for life. But most of these medications, which are largely generic, came out in the 80s and 90s and have a 35 to 50 year even level of success. So we don't really think there's unexpected side effects that come from these medications, and we do know the benefits that can come from them. And I would say, in addition to blood pressure medications, if we're in the business of decreasing cardiovascular risk, it's important to work with your doctor to look at your cholesterol, to look at other cardiac risk factors such as smoking and diabetes is not well treated, because we don't want to just treat one thing but ignore another thing. We really want to decrease your overall cardiovascular risk. I think most people in this meeting would like to have their overall cardiovascular risk minimized, not just sort of tapped down to a good enough level. And our business here is minimizing cardiovascular risk.
Now, here's my last question for you. So during the pandemic this year, last year and this year, as we're into a year now, a lot of people picked up walking. I saw so many of my neighbors and my friends, they started taking walks on a more regular basis. Can that help with your blood pressure?
Oh, by all means. I think the key thing to look for is a type of exercise that you could do for 30 minutes per day, in addition to what you're normally doing. Like, if you normally are, if your job makes you walk a mile a day, you need to find something in addition to that. That doesn't count. And I think what most people found out is they could just walk out the front door and walk. And what I did in many days is you walk away from your house for 15 minutes, and then you're stuck because you have to walk back. So that'll give you your 15 minutes of exercise, 30 minutes of exercise in total. So, the next day you might walk out 20 minutes and come back, giving yourself 40 minutes. So you may be somebody who can reasonably run for 45 minutes a day, 6 days a week, and that's great. Or you may be somebody who reasonably can take a 15-minute walk once a day, 3 days a week. But whatever you can do that's in addition to what you normally do is important. And another thing that we learned during the 1-year pandemic here is that people who have hypertension and other chronic diseases that are not well treated did less well during COVID. And, we hope this is going to be our last public health problem in our lifetime, but, it's always good to be prepared. And if your blood pressure is under better control, you're in better physical shape, your cardiac risk is modified, you haven't had a heart attack, stroke, or need for dialysis, you'll do better no matter what comes to you in life, whether it's the next pandemic, which I would just dread thinking about that, or whether you need your gallbladder out, or whether you need a kidney, whether you have a kidney stone, or whether you have a pneumonia. You'll do better if your overall cardiovascular risk is minimized.
Dr. Visigliano, thank you so much. And if you can just stick with us, because we might have some questions for you at the end. Please make sure you put your questions in the chat box for Dr. B as we move on to our next guest from Hillrom. That is Susan Mangiacaro and David Quinn. And Susan Mangiacaro is the Medical Affairs Manager at Hillrom, where she leads the Frontline Care Division, serving as the clinical expert, ensuring strategic development of clinical evidence. In addition, she is a frontline responder and leader in global emergency response to natural disasters, humanitarian crises, and infectious disease outbreaks. She recently responded to the COVID-19 crisis in NYC, the epicenter of the pandemic last April. There, she led a team into the hardest hit boroughs and hospitals in NYC and provided urgently needed medical relief with staffing, supplies, and surge capacity facilities during the peak of the crisis. David Quinn is the chief scientist at Hillrom with over 30 years experience in medical device design, development, and manufacturing that has resulted in many commercialized technologies and inventorship on over 125 issued US and international patents. He is an internationally recognized expert in biomedical measurement technology, serving in local, national, and international leadership roles for the innovation and advancements of those technologies. He serves as the producer chairman of the Association for the Advancement of Medical Instrumentation Sigma-Manometer Committee, and as an elected U.S. expert to ISO blood pressure and clinical thermometry working groups. And Susan and David, we are delighted to have you both with us today and excited to learn what's happening in the blood pressure device industry and how that translates to individuals like those participating in the Check It Challenge. And Susan, we'll start with you. We just heard Dr. B talking about, at home blood pressure monitors. And we know sometimes when we're out visiting family or we're out at a pharmacy, we might see blood pressure machines that we want to use. But we should be careful, correct, when we're just using any metric, any meter, because there are some specific things to you personally that will help give you an accurate reading. Can you talk about that a little bit?
Absolutely. I'd first like to kind of just mention how important it is to follow proper technique when measuring your blood pressure. And this will kind of relate to your question. We heard from Dr. B about the risks associated with high blood pressure, why it's so important to track your blood pressure. However, I'd like to talk today about why it's so important to follow proper technique when taking your blood pressure. And the reason being is that even small inaccuracies, as he mentioned, can have consequences for patients. For example, underestimating your true blood pressure by even 5 millimeters of mercury or 5 points, that could mislabel you as prehypertensive when you're actually truly hypertensive. And we heard about all the negative potential impacts that can have. Using your own cuff that has been fit for you properly and that has been calibrated, and that you check with your physician and provider to be sure that it's working properly, will give you an accurate measurement, and that's critically important.
And we'll talk to David here for a second too. Can you talk to us about some great devices, David, that people can choose from? Talk about some of the devices that we can pick from.
Yeah, thank you, Natasha. We're living in a great time, even though it's been a rough year or so. The devices and the technology that we have for monitoring our health and for taking care of our health are really very good. And just a few comments that I would like to make about some real life decisions as you walk into the pharmacy or a big box store to purchase a blood pressure device. It's always good to use your doctor as a resource and bounce some things off of him or her. But today, in the eyes of the FDA, there is no difference between a home blood pressure device as far as accuracy goes and a professional blood pressure device. So the same clinical tests are required, the same accuracy specifications are required. And so if you're buying something, most of what you purchase, I would recommend an fully automated device, because otherwise it can be a little difficult to use. They do a pretty good job. And there are a couple exceptions which I would point out because it's meaningful to me. I take blood pressure medicine every day. I need to, and that's okay. But there are a couple of things that could throw things off. One of them I'd like to talk about is the wrist blood pressure devices. So the wrist blood pressure devices, they can take blood pressure, and that blood pressure is the blood pressure at your wrist. However, the blood pressure at your wrist is not the blood pressure that we would use to categorize you, as Dr. B was talking, as hypertensive or normal. That's a different blood pressure. So that's one of the concerns with wrist devices. The other concern with wrist devices is that it's very important, the elevation of that device as you're taking your reading. For each inch you have that device above your heart, the blood pressure reading will go down by 2 millimeters. So if you're 10 inches above your heart, then you're going to be 10 millimeters off. I'm sorry, 20 millimeters off, which is a substantial change. It's very difficult to get 10 inches away from your heart level when you've got a cuff on your upper arm. And so those are a couple of the reasons why I would shy away from the wrist devices at this time. Other than that, one other thing to watch for is a lot of devices now have a cuff that's considered a wide range cuff. In other words, it's made for a lot of different arm circumferences. And that is okay as long as you're not at the edges of that cuff. So there will be a range marker on the cuff somewhere that says it's good for arms from one size to another size. I wouldn't buy a device with a cuff where you're right on the edge of the range, because that can really bias the results one way or another. The cuff sizing is extremely important. And so the last thing I'd like to talk about is the signal that that device is looking at is very small. They're very small pulses that are caused by the artery that's under the cuff inflating and deflating with blood. And so staying still is very important. You do need to just stay as still as possible, especially if you're a little bit shaky, like I am after a couple of cups of coffee. Then you really do need to rest your forearm on something, because what seems to be trivial movements in your hands or in your arm end up being pretty big disturbances in the signal that's coming to the device, and makes it difficult for the device to give an accurate reading. I guess I do want to say one more thing. It's good for me to think of my blood pressure, and maybe Dr. B can add to this afterwards in our discussion time, to think of my blood pressure more as my heart rate. It's not consistent. It's not the same from one time a day to another. It's supposed to change, right? It's supposed to supply my body with the blood that's needed. And if I'm exercising, or if I'm excited or afraid, then my blood pressure will go up. So when we give these numbers of limits of normal 120, 130, what we're talking about is resting blood pressure. And Dr. B talked about this, where you really need to sit down, relax for 3 to 4 or 5 minutes, and let your blood pressure come to where it's going to naturally rest. And be consistent about that as you measure, because you're looking for the absolute value of your blood pressure, but you're also watching for changes. And the meaningful changes are changes that happen in your resting blood pressure. So I'm glad to have the opportunity to talk to you.
Thank you, David. And we'll go back to Susan for this next question here. And Susan, tell us about how to properly take our blood pressure with one of those automatic cuffs that David was just talking about.
Sure, absolutely. So first of all, I'm going to show you a short video, but before I do, a couple of points. As Dave and Dr. B mentioned, your blood pressure is impacted by various different things. A cup of coffee, smoking, activity, anxiety, if it's hot out or cold out, and in your mood, psychological factors. So be aware of those factors. And one of the things that we suggest is that you take your blood pressure in the morning before you take any of your medications. And when you're first beginning to monitor your blood pressure at home, it's really good to do so by measuring it twice a day, morning and evening, 2 times in the morning and 2 times in the afternoon for about a week. That kind of establishes a bit of a baseline for you. And be sure that you record all of this information down on a piece of paper or electronically, so that you can share that with your provider, the date and time of day. And if it's extremely high and there's something that's going on, it's a good idea to note that as well. So do so for about once a week. And then thereafter, we still suggest that you take your blood pressure in the morning before you've had any caffeine, before a cigarette, and before any exercise. And after you've been up for a little bit and had a few minutes to sit down and relax, and just, kind of try to normalize yourself, and then continue to do so and continue to record. There's a couple of other pointers. Make sure that you use the bathroom and empty your bladder rather than having to go to the bathroom when their blood pressure is being taken. A couple of things like that, just to keep in mind, just to be sure that you're getting an actual read. Dave mentioned the cuff size. It's extremely important. Very often I'll go to the doctors and they'll use the wrong size on me, and it impacts your blood pressure and can very significantly. So have your doctor or nurse explain to you what size is the best size fitting for you. I'm going to now share a short video with you, if you bear with me while I share my screen. Doesn't seem to be.
To take a blood pressure reading, remove any clothing that covers your arm. Place the cuff snugly over your upper arm while extending the tube down to your hand. The cuff should be positioned 1 inch, about 2 fingers above the bend in your arm. Once you have it in place, secure the cuff with the Velcro using the reference marks made by your healthcare provider. Sit with your back supported, legs uncrossed, and feet flat on the floor. Place your arm on a supportive surface like a table or the arm of a chair. If possible, rest here for 5 minutes to ensure an accurate reading. Then press start to initiate a reading. You'll feel the cuff inflate as the device takes a measurement. Once complete, your final blood pressure reading will display on the screen.
Hopefully you could all hear that. And then the only other point they mentioned was to position the cuff like 2 fingers above the bend in your elbow. The other thing to keep in mind, it should be snug so that no more than 2 fingers can fit between the cuff and your arm. And be sure to have a bare arm. Very often people have clothing, and that will also impact your blood pressure read.
Thank you, Susan. That video was very helpful. Thank you for that. And really quick, I'll ask one last question to our Hillrom team, to David. And David, I just want to know really quickly, why should we take our blood pressure monitors to our doctor?
It's important to, as I said, most devices today that are available are very good. However, over time, they can fall out of calibration. And the less expensive they are, the more prone they are to becoming uncalibrated. So that's one of the reasons that's good to take your device to your doctor, just sort of compare what the doctor's getting versus what you're getting with your device. Secondly, as Sue mentioned, it's critically important that you get the right cuff. And there are times when it's a more difficult decision than you would think. There are usually range markers on the cuff, but your doctor is going to be able to tell whether that cuff is the correct size for your arm or not. And if the cuff is not the correct size, then you're going to get an artificially high or an artificially low blood pressure, depending on which direction that you're going. And sometimes there are decisions to be made if the cuff doesn't fit between your between your shoulder and your elbow. If the proper dimension cuff doesn't fit there, then you have to decide with your doctor what the best alternative or compromise is for that. So it is important to do that, to make sure that what you're doing is useful when you're home.
Thank you for that, David and Susan, our Hillrom team. We appreciate that. And just as a reminder, you can add your questions to the chat box for David and Susan, and we will get to those right after our next guest or our next panelist. I'd like to welcome Dr. Shannon Miller. Dr. Miller is the Director of Patient Outcomes and Pharmacy Technology Optimization for Kinney Drugs. She has worked as a clinical pharmacist and diabetes educator for the past 15 years. Dr. Miller, we've heard about blood pressure treatment and the importance of self-monitoring. Can you share where medication adherence and working with the pharmacist comes into the management of hypertension with us, please?
Yeah, thank you for having me. So we heard from Dr. B. He went over the importance of, keeping your blood pressure low to lower your risk of complications like stroke and heart attacks, and that, lifestyle modifications are not always effective enough. And that's where medications come in. Now, the type of medication that you're prescribed is actually based on a lot of different factors. And one of the great things is that there are lots of options for medications that lower your blood pressure. You know, you can pick a medication based on multiple factors, working with your doctor and your pharmacist. You know, if you're concerned about side effects, there are medications with very low side effect profiles, insurance coverage. Luckily, most of the hypertension medications are generic and at low cost. If you have a preference for once a day medication versus twice a day, there are options for you as well. But some of the selection comes down to just some intrinsic qualities in patients. So some medications work better for the patient's age. Some medications work better in certain races versus others. And there are some medications that are preferred based on the comorbid conditions that you have. So the other health issues that you have going on, your blood pressure medication may be selected to help with those as well. And a good example of that is a class of medications called ACE inhibitors or ARBs, which can also be selected in patients with diabetes, as they've been shown to lower the risk of kidney disease as well. So when you do talk to your pharmacist about the medications that you're on, they may ask you some questions about the medications, such as, you know, just in general, asking you how you take your medications each day. You know, do you take it with food? Do you take them with other medications that you have? Do you take your blood pressure medication each and every day? Because medication adherence is so important with high blood pressure medication. And one thing that we see a lot is that high blood pressure in and of itself doesn't always make the patient not feel great. So starting medication to lower it sometimes doesn't have any visible visible effects for the patient to say, oh, I am getting, you know, benefit from this medication. So that's why it's so important to follow the guidelines that Susan just went through about checking your blood pressure at home so that you really know that it's working. But the pharmacist may also ask you if you have had any side effects to the medications, if you're having any issues affording the medication, and then they'll work with you to develop a medication action plan. So if you're having difficulty taking your medication because you keep forgetting, there are options. There are apps to help remind you when to take your medication. The pharmacist can help you find, you know, a normal daily activity that you already do and pair that with taking your medication. There's the obvious pill organizers. There's also the option now in many pharmacies to get your medications packaged all together in a pouch so that, you know, you don't have to worry about organizing them into a pill organizer. There's also, you know, working with the pharmacist at all of your medications together. Is there a way to reduce the number of medications that you're taking? Are there combination drugs that you could take so that instead of 2 pills, it now becomes 1? Is there the option for tablet splitting or generic substitution to help with cost if that's a concern? Pharmacists also have some resources to help patients, you know, in working with caregivers to ensure that the caregiver is educated about medication as well. So it's super important to take your medication as prescribed, even if you don't feel, you know, the benefits from it. Checking your blood pressure each day and knowing your numbers will get you on the right track.
Well, right now it is cold and flu season, although, you know, the flu has been pretty low this season. But just for a future reference, during cold and flu season, when we take some of those medications to help us get over those symptoms from those diseases, can that raise our blood pressure by taking those?
There are some over-the-counter medications that can raise your blood pressure. So if you're someone who does take treatment for high blood pressure, It's always great to run over to the pharmacy counter and ask the pharmacist to review those medications with you to make sure that there's not a chance that it's going to raise your blood pressure or not a chance that's going to interact with any other medications that you're on.
And while we're running over there to talk to the pharmacist to ask those questions, can the pharmacist actually check our blood pressure for us?
Yeah, that's a great question. I know most pharmacies have a self kiosk where you can check your blood pressure. Right now, because of COVID, many of those kiosks are not available for self use. You can ask the pharmacist to check your blood pressure. All of our kidneys have blood pressure cuffs there for use. But I do highly recommend to patients to have a monitor at home so that they can check each and every day. It's hard to, base any kind of decisions on one reading to see if your medications are truly working for you. Because as Susan said, there's a lot of things that could impact that, right? You're running into the pharmacy, you're pulling off your winter coat, you're, not necessarily settled down totally. So make sure that everything that she covered as far as things that can influence checking your blood pressure, you take into account when you go to visit the pharmacist as well.
And just one more question for you here. What is one of the most common questions that you get from people coming into the pharmacy about blood pressure medication?
I think one of the most common things that we see is this actually working? They don't necessarily feel any different. And you can say the same thing for cholesterol medications. The fact is really in the numbers, right? Making sure that you're checking your blood pressure every day, knowing your numbers so that you know if it truly is working for you, because you don't want to wait until you have one of those complications to know whether or not it was working, or go a whole 6 months in between doctor visits.
All right. Well, great advice there, Dr. Miller. Thank you so much. And now I think we have a little bit of time to answer some of those questions that came into our chat from people. So we're going to work with the American Heart Association representatives for that. I believe Mark Natali has been taking those questions down for us, and he will feed them to us and so that the panelists can answer them. Mark?
Absolutely. Thank you so much. And thank you everyone for such great questions that have been coming in. We have at least one for each of our panelists. Dr. B, since you popped on screen, we're going to go ahead and give you the first one. Can you explain the top number and bottom number? What do they actually represent and which is more problematic?
Thank you very much for that question. So the top number is the blood pressure when your heart is squeezing, when it's pushing the blood through all of the arteries. And when that happens, all of the arteries, particularly the larger central arteries in the chest and down the legs, expand a little bit because it's like pushing a whole lot of fluid through a garden hose, just a little bit of an expansion. And then in between beats, when the heart is resting, all of these arteries spring back, and that's the bottom number. So if somebody is young and healthy, we see when the heart squeezes, the top number doesn't go up much. There's just a good flow of blood. And there's a good recoil, which keeps the bottom number sort of on the high side. If you go on the other side of the spectrum, let's say a 90-year-old who has some very thick calcified arteries, when the heart squeezes, they get a spike in blood pressure of like maybe 180 or 190, but the bottom number tends to be very low because there's not much of a recoil. But as far as what's clinically useful here is for people over the age of 50, the top number is the number that really correlates with bad things, with heart attack and particularly stroke. So we often use the top number as the main target in treating blood pressure in people over 50. In people under 40, they tend to get what we call isolated diastolic hypertension, just a high-low number. And we treat that a little bit differently with a different selection of medications, beta blockers, maybe some diuretics, because people who are younger tend to have just sort of a hyperdynamic, a very active heart when it squeezes. And between 40 and 50, it can go either way. So for most people who have high blood pressure, it's the top number, because most people have high blood pressure over 50, It's the top number which we really look at, because that's the one that's associated with the bad things that come from high blood pressure.
Thank you. And the next question, I see Susan is on, so we'll give that right over to you. How do you know when your personal blood pressure machine needs to be calibrated? How do you go about calibrating it? How often should it be calibrated? And how do we actually know the doctor's office is correctly calibrated? And David probably can help you on that one as well.
I'll start and then I'll hand it over to Dave. So it's a good idea to bring your blood pressure monitor, your at-home monitor, to your doctor's office. That way they can compare your blood pressure reading on your monitor and your device that you use at home with the monitor that they have in the office, or their monitor that has been calibrated. How can you ensure? I might turn that over to Dave as far as the regs are concerned. And most offices do a calibration of their devices, but Dave can kind of answer from the regulatory perspective. But typically, what we find is most of the at-home devices, like all of our electronics, they have a certain shelf life. And after a couple of years, depending on the device and the cost, et cetera, they may not be as accurate after a couple, 2 or 3 years period of time, depending on the use. They may have to be replaced. But the key is being sure to bring your device into the doctor's office. They can then check your device against a calibrated device taken in the office and make sure that they're measuring very closely. And Dave, if there's anything to add to that.
Yeah, maybe just to address the devices in doctor's offices and hospitals. So the doctor's office is required to follow whatever the directions are for the device. And most devices, blood pressure devices, require a calibration check every year. Hospitals will also do that in their biomedical department. They will check every year. And so it's a very rare occasion now, especially with electronic devices, that the equipment in a doctor's office or in a hospital would be broken or way out of calibration. That wasn't always the case with dial aneroid gauges you would see on the wall with pointers pointing all different directions if they got dropped a couple times. But the electronic ones are pretty good and much better even than they were 10 years ago. In the home devices, there's a different type of blood pressure sensor that's now affordable. I guess that's the other thing I would mention is that in the doctor's office, that's probably $1,000 machine instead of a $50 machine. And so there are many checks and balances. I can speak for the Hillrom devices actually have 2 pressure sensors in them that check against each other. Just whenever you turn it on. So
thank you both very much. And Susan, if you can come on, I'll give you the next one.
Okay.
And the question, or I'm sorry, Shannon. Sorry, Susan.
No problem.
Shannon, there she is. Hi, Shannon. Question probably for you here. Are all blood pressure medications the same?
No, there's a lot of different classes of medications, and some are better for some people and some are better for others. That's why it's important to sit down with your doctor and your pharmacist to discuss, what fits into your lifestyle and what's best for your current health situation.
And what are some of the mitigating factors that might be, say, a lisinopril versus a different beta blocker or those types of drugs that would be prescribed?
So diabetes is one example where we might pick one type of medication over another. So we might use lisinopril in a patient with diabetes versus the beta blocker is one of those instances. Kidney disease can influence that as well. Race, our African-American population tends to do better on diuretic medications as opposed to some other medications as well.
Okay, and next question, maybe Dr. B, how are those medications actually helping the underlying causes of blood pressure and hypertension?
So for most people, the underlying cause of their hypertension is that they have a genetic predisposition to hypertension. It comes from their genes, and it's not necessarily something that's going wrong in their body. About 5% of the people have hypertension that's worsened because of kidney disease. Some people have it because of thyroid disease, adrenal gland disease. So there are specific medical conditions that can make the blood pressure go up. But for most people, your age and your genetics set your blood pressure at a certain level. And things that you do, increase sodium intake, salt intake, weigh more, exercise less, become less physically active, that can drive the blood pressure up. So the blood pressure medications aren't really doing anything to change the underlying thing that's causing the high blood pressure, because for most people that would be changing their genetics. It's hard to change one's relatives after a while, even though some people might want to try that. It's just you can't do that. But what it does do is it does change your outcome. It improves your overall outcome in decreasing heart attack, stroke, and kidney disease. So even though it doesn't change the underlying cause is not something that's easily changeable beyond the normal lifestyle modifications.
Thank you. And maybe a little follow-up there. Is water retention considered to be a factor or element that causes hypertension?
And in certain people, water retention can raise the blood pressure. One of the first line medications that we use in many people, and it doesn't have to be first or even second line anymore, we used to use it as first line all the time, are diuretic medications because they enable you to excrete more sodium. If people are massively fluid overloaded, it can increase their blood pressure. But generally speaking, we use diuretics, water pills, in treating high blood pressure to enhance the excretion of sodium through the urine. So fluid retention can happen in people with hypertension. Since kidney disease, which causes sodium retention, which causes fluid retention, can also drive up blood pressure, sometimes we need to use a medication regimen that has a little more diuretic in people with kidney disease. But I think that's, I hope that's a good answer to that question.
Yeah, thank you. And we have probably time for two more here. So let's go with maybe David. David, you spoke about wrist devices, and there was a question that all I have is a wrist device at home. If I practice all the good efforts of posturing and being quiet and all of that, will I still get an inaccurate reading?
So it definitely helps if you're doing everything right. Particularly, I did see the question come in, particularly if you've got that wrist device at heart level. That can be take care of one of the larger problems with a wrist device. Wrist devices, they do have their place. They are more comfortable. They're easier for people to put on. And so if there's some reason that you can't use an upper arm device, then a wrist device might be the right solution for you. However, the underlying problem is always there, and that is that if you think about your upper arm, there's one bone, right? And the arteries are outside of that. So when the cuff squeezes, it's squeezing on the artery, and there's nothing other than tissue that's keeping that air pressure from creating pressure on the artery. Down at your wrist and your forearm, there are two bones, and your arteries are in between those. And so that can cause a problem with some people's anatomy for sure, that the cuff is not able to properly transfer the air pressure that's in the cuff to physical force on the artery, and therefore would give you a different reading. So I would say probably better than nothing, but with the upper arm, with the wrist cuff. But if you can move, if it's possible for you to move to an upper arm cuff, then that's a better choice.
Great, thank you. And maybe with about a minute here, Dr. B, we have a COVID-19 related question for you. If somebody was diagnosed with COVID-19, positive, never had hypertension prior, have you seen some irregularities post COVID-19, being positive of COVID-19 post with blood pressure irregularities, like increasing or any other residual effects?
You know, what I have seen, and I think it applies to other conditions as well, is whenever anyone has had a major illness of some sort, you know, pneumonia, other kinds of infections, other kinds of illnesses, you know, surgery, there is a certain bounciness in blood pressure, irregularity in blood pressure that can persist many months after the illness. It tends to settle down after a while. And I think really COVID is no different in that. You know, if there's specific damage, you know, to kidneys or to other organs during COVID, that could certainly be the case, or during any illness. But I do find that after any major illness, people's blood pressure does bounce around a little bit for a few months, but does tend to settle down after a while.
Okay, and I will turn this back over to Tanisha.
Awesome. Thank you, Mark. And thank you to all of our panelists that joined us today. Thank you to everyone who's joined us today. We appreciate the questions and the feedback and the encouraging words. And we just want to remind you that our next Check It community conversation is scheduled for Tuesday, March 23rd at 11 a.m. And that one is going to be on Eat Smart for Heart Health. And we hope to see you all there. And I'd just like to quickly thank the American Heart Association for even considering me to be a moderator today. Thank you. It was an honor and I appreciate it. And we'll see you all next time. Thank you.